Have you ever felt unusually tired or found your mouth unusually dry? You might be surprised to know these could be signs of dehydration. This seemingly simple condition can actually have profound effects on your body and overall health. We're here today to delve deeper into the world of dehydration, exploring its signs, symptoms, and most importantly, how to prevent it. We'll be touching on some key points including the common signs of dehydration, why some demographics like the elderly are more susceptible, and the role certain medications play in causing dehydration. If this is your first time joining us, or you missed our previous video on effective ways to hydrate, don't worry, we've got you covered. Just click on the link in the description below to catch up. Stay tuned as we dive into the signs, symptoms, and prevention of dehydration. You won't want to miss this enlightening journey into the hidden depths of hydration and health. So, what does dehydration look like? It's not just about feeling thirsty. Indeed, thirst is just one of the many signals your body sends when it's running low on water. But there are other signs, some of which are subtle, that we often overlook. Let's start with the most common symptom: increased thirst. This is your body's first line of defense, a clear signal that you need to replenish your fluids. But remember, by the time you're feeling thirsty, you're already mildly dehydrated. Next up is dry mouth. It's that uncomfortable cotton mouth feeling that can make swallowing food a chore. This is because saliva production decreases when you're dehydrated, leading to a dry mouth and throat. Don't ignore this sign. It's your body's way of telling you to drink up. Have you ever noticed a change in the color of your urine when you haven't had enough to drink? Dark yellow or amber urine is a classic sign of dehydration. Ideally, your urine should be a light, straw-like color. Any darker, and it's time to reach for a glass of water. Fatigue is another common symptom. You might feel sluggish, tired, and low on energy. This is because dehydration can decrease blood volume, making your heart work harder to push oxygen and nutrients through the bloodstream to your muscles and organs. This can leave you feeling exhausted, even if you haven't done anything physically strenuous. Headaches are another sign to watch out for. Dehydration can trigger headaches and even migraines in some individuals. This happens because a lack of water can cause your brain to temporarily contract or shrink from fluid loss. This results in a dehydration headache, feeling lightheaded or dizzy. That's another sign. Dehydration can lead to a drop in blood pressure, which can make you feel faint, especially when standing up quickly. Lastly, let's talk about skin elasticity. You can check this by pinching the skin on the back of your hand and seeing how quickly it springs back. In a well-hydrated person, the skin should snap back immediately. If it takes a few seconds, you might be dehydrated. These are just a few of the signs and symptoms of dehydration. It's crucial to recognize them early, as prolonged dehydration can lead to more severe complications. Remember, prevention is always better than cure. So make it a habit to sip water throughout the day, especially if you're active or it's a hot day. Now that you know the signs, you might wonder if everyone experiences dehydration the same way. Well, the answer is no. There are certain factors that can make some people more prone to dehydration than others. But that's a topic for the next scene. Stay tuned. Our water needs change as we age, and so do the signs of dehydration. As we grow older, our bodies don't conserve water as effectively, and our sense of thirst may not be as sharp. These factors make it easier for elderly individuals to become dehydrated. Dehydration in the elderly can be subtle, often masked behind symptoms that we might chalk up to old age. But let's put a magnifying glass to these signs, because understanding them can make a world of difference. First off, let's talk about confusion and dizziness. These are common signs of dehydration in the elderly. If you notice an elderly loved one suddenly seeming disoriented or experiencing unexplained falls, it could be down to dehydration. Next up, we have fatigue. It's not uncommon for elderly individuals to feel tired, but if they're feeling excessively sleepy, it could be a sign of dehydration. Dehydration makes the heart work harder, leading to feelings of tiredness or fatigue. Dry skin is another sign. You might think dry skin is just part of growing older, but it can also be a symptom of dehydration. Pinch the skin on the back of the hand. If it doesn't bounce back quickly, it might be a sign of dehydration. Decreased urine output is yet another sign to watch out for. If an elderly individual is going to the bathroom less frequently, or if their urine is a dark yellow or amber color, it could be a sign that they're not getting enough fluids. Dehydration can also cause constipation. The body pulls water from the stool to compensate for fluid loss, making it harder to pass. Lastly, rapid heart rate or breathing can be a sign of severe dehydration. If you notice these symptoms, it's important to get medical help right away. So we see that elderly individuals are at a higher risk of dehydration, and the signs can be different from those in younger people. But why exactly are the elderly more prone to dehydration? There are a few reasons for this. Firstly, as we age, our body's ability to conserve water decreases, and our sense of thirst becomes less acute. These factors can lead to insufficient fluid intake. Secondly, elderly individuals may have conditions or take medications that increase their risk of dehydration. For example, people with dementia may forget to eat and drink, and certain medications can cause fluid loss. Lastly, mobility issues can make it difficult for some elderly individuals to independently access water. Given these factors, it's crucial to monitor hydration in the elderly vigilantly. Encourage regular fluid intake, even if they're not thirsty, and ensure easy access to water. Make hydration a part of their daily routine, like brushing their teeth or taking their medication. But it's not just age that can affect your hydration level. There are other factors at play, and in our upcoming segment, we will delve into how medications can contribute to dehydration. So stick around, there's plenty more to learn about this vital topic. Did you know certain medications can contribute to dehydration? Yes, indeed, medications can play a significant role in causing dehydration. But how does this happen? Let's dive in and understand this. Medications can lead to dehydration in two primary ways. First, some medicines increase fluid loss in the body. They do this by encouraging the kidneys to flush out more water and salts, leading to an increased volume of urine. This is commonly seen with diuretics, a type of medication often used to treat high blood pressure and heart conditions. Second, certain medications can affect the body's ability to retain water. This happens when these drugs interfere with the action of antidiuretic hormone, or ADH, which helps the kidneys reabsorb water back into the bloodstream. Lithium, a medication used for bipolar disorder, is one such example. Let's delve a little deeper and take a look at some common medications that may cause dehydration. As mentioned, diuretics are a prime example. These are often prescribed for conditions such as heart failure, liver cirrhosis, and some kidney diseases. They work by helping your body get rid of unneeded water and salt, which can lead to dehydration if not properly monitored. Another group of medications to be aware of are antihistamines and decongestants. These drugs, often used for allergies and colds, work by drying up secretions in the nose and throat. However, they can also decrease overall body water content, leading to dehydration. Certain psychiatric medications like lithium and clozapine can also cause dehydration. Lithium can interfere with the kidney's water-conserving mechanisms, while clozapine can cause excessive sweating, both of which can contribute to dehydration. Lastly, some chemotherapy drugs can lead to dehydration due to their side effects such as vomiting and diarrhea. Now, this doesn't mean that if you're on these medications, you're destined to be dehydrated. It just means that you need to be aware of this potential side effect and take appropriate steps to stay hydrated. If you're on any of these medications and you're experiencing symptoms of dehydration such as increased thirst, dry mouth, fatigue, or dark urine, it's important to consult your healthcare provider. They can help you navigate the situation, possibly by adjusting your medication or providing strategies to help you stay hydrated. Remember, staying hydrated is about more than just quenching your thirst. Water plays a critical role in many body functions, including regulating body temperature, lubricating joints, and carrying nutrients to cells. So it's crucial for our overall health and well-being to keep our bodies adequately hydrated. And if dehydration persists, it can lead to more serious issues. So it's essential to understand the link between medications and dehydration. Stay informed, stay hydrated, and stay healthy. Prolonged dehydration is not just discomforting, it can lead to serious health problems. When your body doesn't get the water it needs, it begins to pull water from its own tissues and organs, which can lead to a cascade of complications if left unchecked. One of the most common complications of chronic dehydration is the formation of kidney stones. These hard deposits of minerals and salts form when your kidneys don't have enough water to properly dilute the substances in your urine. The result? Painful stones that can take weeks to pass. But kidney stones are just the tip of the iceberg. Dehydration can also lead to urinary tract infections. Without enough water to flush out bacteria, these pesky microbes can multiply and cause infections in the urinary system. Symptoms can range from a persistent urge to urinate to lower abdominal pain, and if left untreated, these infections can spread to the kidneys, causing more serious problems. And while we're on the topic of serious problems, let's talk about heat-related illnesses. These can range from mild heat cramps to life-threatening heat stroke. When you're dehydrated, your body's ability to regulate its temperature falters. This can lead to heat exhaustion, characterized by heavy sweating, weakness, and dizziness. If not addressed quickly, this can progress to heat stroke, a medical emergency characterized by a body temperature of 104 degrees Fahrenheit or higher and potentially causing complications like organ damage or even death. Beyond these direct complications, dehydration can also have indirect effects on your health. For instance, it can affect your physical performance and cognitive function. Ever notice how you can't think clearly or perform well in your workout when you're thirsty? That's your body telling you it needs water. And it's not just about physical performance. Dehydration can also affect your mood, leading to feelings of irritability and decreased concentration. It can even affect your heart, as your body compensates for the lack of water by increasing your heart rate and causing palpitations. These complications underscore the importance of hydration for overall health. Water is essential for nearly every function in our bodies, from maintaining body temperature to removing waste. It's not an overstatement to say that staying hydrated is one of the most important things you can do for your health. But remember, it's not just about downing 8 glasses of water a day. Your hydration needs can vary based on factors like your age, gender, weight, and activity level. Listen to your body's signals, like thirst and the color of your urine, and make sure you're adjusting your water intake accordingly. So next time you feel that thirst coming on, don't ignore it. Grab a glass of water and give your body what it needs. After all, your health may depend on it. So keep an eye out for these signs and ensure you stay hydrated. So, we've covered a lot today about dehydration, but the key takeaways are simple. Firstly, remember that dehydration is not a condition to take lightly. It's more than just feeling thirsty. It's a state where your body doesn't have enough water to perform its critical functions. Recognizing the signs is essential. Dry mouth, increased thirst, dark urine, and fatigue are all telltale signs that your body might be crying out for more water. We also discussed the unique challenges faced by our elderly population. As we age, our bodies may not signal thirst as efficiently, and conditions like confusion and dizziness can be exacerbated by dehydration. So let's keep a close eye on our older loved ones, ensuring they're consuming enough fluids. On the topic of medications, it's crucial to understand that some can contribute to dehydration. They might increase fluid loss or interfere with your body's ability to retain water. So, if you're on medication and experiencing symptoms of dehydration, it might be worth having a chat with your healthcare provider. And let's not forget the potential complications of prolonged dehydration. It's not just about feeling a bit sluggish. It can lead to more serious health issues like kidney stones, urinary tract infections, and heat-related illnesses. Staying hydrated isn't just about quenching your thirst. It's about maintaining your overall health and well-being. In conclusion, it's all about being proactive rather than reactive. Listen to your body, watch for the signs, and respond accordingly. And if you're in a position to help others, especially the elderly, do so with kindness and vigilance. Dehydration is preventable, and with the right knowledge and habits, we can help keep ourselves and our loved ones healthy. That wraps up our discussion on understanding dehydration. Don't forget to like, subscribe, and share this video to spread awareness about dehydration. Thanks for watching. Feel free to leave any questions or comments below.